Dear viewers, welcome on Smart Talk 1555 of 2023 that declares that anthrax breakout banned the movement of live animals, animal products and animal byproducts into, within and outside the hotspot areas of Southern Province, Western Province and the Lumen district in Eastern Province. But before, a press statement on anthrax on 1st November 2023, which gave a cumulative 335 cases and 4 deaths reported across the country in 6 provinces of Zambia and Southern Province, recording the
may not be associated with fever, it may be painless, but it's soon after it starts going deeper to ulcerates. And it starts making black spots on the skin. And the patient now will getting the effect because the lymphatics of the affected part of the body will carry that infection. So the lymph nodes in the area, in Nyanja Ukoiti Mwanabere, I will come to Nyanja later, but the lymph nodes start swelling. But that infection is very virulent. It produces the toxin. The toxin breaks through the barriers and it can go into blood circulation. So toxemia, for students to remember, the spreading from an ulcer rash go into blood circulation, toxemic effects start developing. The patient can develop severe shock, and you know with shock, ordinarily affected from head to toe. So that's the danger through the skin. What you have inhaled, it will present as a dry cough. So any area where there's anthrax, any dry cough, take it serious. What do we do?
Before we come to diagnosis,
yes.
Professor, make us understand, how long does it take for one who has taken these bacteria that causes anthrax to be identified or to see the signs and symptoms that the person now has anthrax?
Very true. It depends on the anthrax load, the anthrax, the amount of bacteria that has gone into somebody's body. Watengako. Kula wapumeko mpepo, maspozi yalimo mpepo, watenga yali mchifua, ndiye vuto lake. Na nyama za mtengo zonse nazo zikala nayo matenda ya anthrax. Monga ku game park kuja, ngati buffaloes yakala na anthrax, olo hippo, olo elephant, nyama yonse ina anthrax. Musaigwire, musadie, olo ipeza. Utumani wachipatala akabwera kayangane akaone mene angachitire even waja wa health akapikako kuja avala vovala vija voteteza tupi mamaski mabuti vonse voteteza tupi kutasa gulizane nayo vuto ya anthrax. So azakamba kuti tendi chitetero wambira akamba kuti nyama yofayoka ku area kwa anthrax ni bwino tenda uchita moto okwana ikapyo tukutikiratu. Osati bari yawe napito fukulo siku ndiye vuto. So sichifunika telo. Andigati ni bario kufunika ulo muntu wafana anthrax. Bario yake kale very deep, deeper than normal. Uopa kuti tulombo tuja, sati tuturukire mu environment. Nito vuta uchosa tulombo tuja. So kufunika kasungidwe kaodwala nao odwala kakala kuchipatala wa hospital nao kujazikana na protective clothing. Ma health workers, ma students watu alimfield akale protected kumavuto ya anthrax ngati ali ku area kwa anthrax. So health education, mapunziro ya udongo ya umuntu wa moyo wa bwino nditu yakaleko kuti apewe ndawaulo wa health akoza kufa na vuto la anthrax. anthrax ngati alibe protective clothing. But kuli mankhwala, that's why ndikuti athamangire msanga asazengereze na odwala ya tukapita na omawa yayi kulibe mairo ndawa ikalowa shoko ija ndiye kupha muntu within hours muntu wafa. Sono akapita kuchipatala kuli mankhwala. Effective medicine ni ciprofloxacin 500 milligrams 12 hours, but it passa for 2 weeks. Ngati sakhala bwino tipitilira even 60 days mpaka tulombo tufe mtupira muntu. Ni ciprofloxacin. But ngati ni wodwala maninga achitakale shock ikani madrip ya jamza pasa maji kuti shoko ibwerere. Ifwa shoko blood pressure ikugwa pansi, pulse rate ipita pamwamba, mitundo kutapange muntu chikanga dry, divani kuti muntu andi wakomoka. Samvera umukambe kuti ukani amlenga ukani. Aya nuofoka chifukwa cha anthrax. Lombatero tima chita madrip mina yawiri uku na uku madrip. Nuika po mafluids normal saline, ngwefunikira hapo matuma blood, full blood count matuma, urea electrolytes matuma, so that muone tupiruru sevenza motani. Liver function test matuma. So vonsevo mvakutiviti tandize kodi ma organs ya mtupi, ya ripoti, ya rulepero sevenza oro yai. Shock ndiye funika uchita mind. Ma health workers put up 2 drips, big cannulas to prevent shock deepening and damaging. And you will see the organs, brain will be unconscious. The heart will be beating very fast. Blood pressure is dropping. Power of the pulse is reducing. My kidneys impale. Sisi safer. Mitundo ya ruchepekera siya turuka yokwana ziwanu kuti vuto ngati ni area ya anthrax. So tichite treat shock ma symptoms yonse and the patient ngati mulutitika bwino mzaona wambo chita recover. Na mankhwala jamunu pata ciprofloxacin kujana chita bleed hata lusanza magazi utula magazi mkona vambosia. Blood pressure irubererapo pakale muntu alukala bwino ndimo chifunikira tero treatment. Simgamsiye yeka patient not even for 30 minutes. Ni muntu wakutafunika care from nursing care, medical care, laboratory care, everywhere. Everybody is a teamwork. Mzaona kuti tingapurumuse wantu wambiri upyorera na care attitude towards the patients of anthrax.
Roba professor uzisani wantu chamene chilengesa kuti muntu ankale na anthrax ni chiani, then zisanzo zoonera kuti uyu muntu ali na anthrax is it?
So
na kuti anthrax ingachoke kuwina mu muntu sicho katabe kunyama kubora ku muntu but na
kutoka muntu izowona. So mujataka mbira kuti please kani openya anthrax lagwira muntu ngati mpaskini azachitarashi ona vironda pakapita nthawe mzaona kuti ngati pajalu chitarashi na vironda wambo kosomola dry cough to start with, then upuma kwake mkopitirira ifika muntu wambwino wangwiro apuma 16 times per minute. Mzaona muntu habera kwanu kunyumba ku clinic ali weku 20 times per minute zwane kuti matenda ya lowa. 2 akambo asanza magazi olati agatulule atulwa ni magazi ndio kuti valowanso wadya twina tumaspose tuja wadya uchola mbakudya vili contaminated ni anthrax. Makamaka ngati wadya nyama yofayo kaija olwachita kupha but yaziwa kuti nyodwala basi ngatalibo pika bwino wadya tuja tu anthrax twalowa. So paskini mwapapu na mimba matumbo monse makala anthrax. Ndiye mavuto amene mkaona chabe aludwala muntu musazengereze tamangirani kuchipatala. Anyanchicho wa ma hospital, ma health centers azaziwa kuti ini vuto ya anthrax azamba treatment mankhwala yaliko ciprofloxacin.
Dear viewers, you have gotten it from Professor Lambert. At this time now, we allow you to make calls to ask questions that you may have on anthrax. Kapena kumatenda ye na Dr. Lambert?
Inde
yalionse wangafunse kuti matandizire. So, Dr. Lambert, as you were ending, you said ngati wanapike bwino, they haven't cooked well, or what? What is it? People should eat meat or should cook meat well?
Yeah, that is very delicate. I think at the area ya anthrax, osadya nyama, mpaka matenda yakakale settled. But yakakala settled, we are free, lomba, boma, wachipatala za kuzani, utilomba ya anthrax, tatsiri izayata, then feel free to eat.
Okay.
But ipaka litere for domestic, nyama zosunga izi, tikambe mbuzi, humba, ngombe, vikala affected. Zamtengo, ni hivi ni west. Buffalo, what vonse vamtengo, vikala affected in anthrax. Because na vonso vipema tumaspose tuja. Popema pele tulo mapapu mwake muja. Tuambaso dwelisa mchifua, ngombe, jani, vonse vikala va contaminated, infected na anthrax. So nuyembekeza, ni binodia beans, protein source, you can shift to beans. Or fish, nkasako. But makamaka beans, pakali hot paja. Because you take 3-4 weeks or 1 month, akalulimba na nayo anyanchito wa health, afu na igonjese anthrax, lombai mwemsadiechi idei yai. Mwapangati mwaika kwa miu kunkasako, you know. Ni protein nayo source. And then beans is very safe. Beans is safe because it's of vegetable origin. Yeah, but even vonsevo vikalivo pika bwino because vingakale contaminated by touching. Vikalivo pika mo kwana ziko.
So, Dr. Lambert, when we talk of byproducts, milk is safe. What are other byproducts from animals that people should avoid?
Yes,
in this
but
period?
when it is infected animal, even the milk is contaminated, is infected. Anything fluid in an infected animal, blood, milk, once they meat itself, the hide, they are all contaminated with anthrax. I meant to say that somebody can go to town and get already made long life milk which is safe.
Okay.
Yeah. Beans, you go to a proper shop and get it, it's already covered, properly covered. You eat as a source of protein. Don't worry, you can avoid anthrax is the aim. Avoid. And if everybody is trying to avoid and stop the spread of anthrax, it doesn't take long to control it. Maninga bantu bagwirizana. Lombosa tumuji wachite waleka kudya nyama, wachite ukalikudya, poenderana Mungu pasana matenda. Yeah. Kumoletsana. Mafumu nao wagwepo, mahedimani wagwepo, wantu wamiza gwepo kuno kwa bwana matenda, yofya osadya chidye, osagwira nyama ya kufu, uigwira chabe. Chikumba change chijogwira chabe, mwayatenga, tumaspozi tuja, tulikumanja kwanu. Poti nkadye mirisi, nkadye mosa samba bunabuno manja, tualowa mkati, mwambapo sanza magazi, no turula magazi. Ndiye pali vuto. So it's outbreak. Ni outbreak is as if somebody has thrown a bomb in the area. Ndiye danger ilipo. So mugwirizana wantu kuti tenti gonjese anthrax, tenti mvere boma, tenti mvere wa healthy. Ati uzazotani tingapewe motani andiponi mankwala ni yoti yaliko atipa sanso prophylaxis. Waja ku community kujazabesa madosage ya ciprofloxacin. Mundu aliyensa amwe kuti ngati anadi yako tuferetu situnayambe. Ngati tunalewa mapapu tuferetu situnayambe okosomola ama chitatero. prevention. But chachikulu asagwirizane na nyama za mtengolo domestic azigwire yayi akabwerabo magati kola ili muli anthrax yose kola ipaiwe vitentewe vonse kuja utenta anthrax pachikumba cha nyama cha ng'ombe opa nyama ya ng'ombe vonse vyavodwala vitentewe publicly kutasa kala wotola hapo muntu
sikupanga antu nkala mpawi manje kuba
yayi but vizakala kusogolo ibino kala moyo umpawi sungate but ukala moyo ni bwino chifuanga chepese ku mpawi ndo kasiya wa mwali ya lomba olompawi ozachita banji wasira mavuto wana
nanga timvera kuti animals should be vaccinated. Nanga bantu kulibe vaccine for prevention.
Yes, vaccination is there. You know, even human, animals, vaccination is there. But tele kuti kuja kumena kwa chitika matenda. That's every year. Kuzikala measures to vaccinate.
Okay.
Animals every year bantu akale vaccinated so that you create resistance. Olo ibwerele soka chibiri ikapeza bantu no tetezewa upyorera vaccination. Nyama zonse zijazima lubwesa matenda. Lomba matenda ya pita. Opima aliko azipima continuously. But vaccination yaliko mwachitabu inofunza irofunza.
Professor, in this world we are living today, maka muno mwatu mu Africa nkale mu Zambia kuli kunamizi wa maboza. Kodi is there medicine, traditional medicine for anthrax? Because vantu angazita nindwa bwerani kuno nina mankwala ine anthrax timamvera pa vilimba kambiri no ine matenda alionse ni polesa bwanji ni kuchipatala chabe olo kuli mankwala ya anthrax
yayi ine nakamba nao manganga pa radio ZNBC from 85 until 20 something nawo kamba kuti mankwala yachi muntu anga kaleko yasenga kaleko ngati mvosa tsimikizika munakambira kuti ciprofloxacin niyo tsimikizika aya anthrax matenda ya dziko la pansi lonse so kwanza tukuja napeza mwamsanga kuti ciprofloxacin ndiye mankhwala aya kuti byani njite mayani aya mizwa nchifukwa chake Apex University ilupita mu research. Please, that's why tinapempa kumafumu musateme yonse mitengo tisungire nkoni matengo ya kuti Apex ikachite research tamba kale research kulufunsa mfumu wakuja wachikaweta anatipasa malo yokwana so ndiye research center yatu ubachiru chitira tero tifunga mujaji wakuti naniziwa mankwala ni yakuti akati pasese tikatsimikize tsimi ngati ni mayani tikafinye ngati ni mizu tikafinye mpaka tipeze tujatwa mphamvu tulimo matenyo yako yote anga pawe matenda monga aya tizatsimikiza ndise wa Apex. Tina big research program muno mu Lusaka na kamba za Lufunsa. Kumuchinga tina big area tirugulizana nao wa chief Chikwanda, wa chief Chewe, wa chief senior chief Nkula. Kunoze na atipa samalo ya research kuti mitengo nanji kuja kuli mitengo anzatu sama kumba na miziyome mitengo amadula kwa chabe pasonga pamwamba chitemene chimasunga matrank so mitengo yaliko tifuna tipite mitengo yonse tikapime kuwapula kutatipa samalo ya mitengo kutiti research so tinamba kare research ningakuze nko ni monga kufunsa anatipa sa mitengo 15 yawiri yapezeka kuti yes ya namankwala ato 15 already so tizapita area na area mujana titandiza mafumu atisungire tifuna titsimikizire mwena kuti aya mankwala ni jakuti aya mankwala ni yakuti tifuna tikatsimikize kuti nzowona muli active medicine mitengo ayakamba oluvitsamba vinakamba vonse tifuna tichite research sewa Apex ziko.
Professor Lambert, we are raising awareness on anthrax and you've said it is contagious.
Yes.
So how can people prevent themselves as they attend church services or church masses, whatever?
Yes. During that period of anthrax, vonse nuchita suspend. Muvese kulibo kuma na pamozi. Chifukwa ujawa bwera bwera anthrax vena rukosomola anthrax vena rugwirana paskini manja umwaribo sambabu na pas anthrax ni vuto ya kulmonga kolera. Mujatiji tita kolera, you know. 79 nenali kumpulungu to control cholera. Tina aletsa machechi, wedding, beer drinking congregation vonse vakumama watina aletsa rado. But we had controlled the cholera, and that time within 3 weeks we controlled it by cutting people interacting. So where there is anthrax, mverani wanyanchito wa health azakuuzani how dangerous it is to congregate or to come together. It's a short time. Mukachita control ya disease mzabwerera pakale. But ngati semu mvera la moya health mungawonongeke wambiri the mass destruction ya wantu kufa maliro saleka akaika mzake ndani ndiye vuto lingakaleko.
Okay. And so, Professor, how common, like in Zambia, how has anthrax been? But
this time it was very widespread. Makamba mweka uti southern, western, Lumezi, then Kunawalia. So it is spreading fast. But what I've heard, I think TV yesterday, Anakamba uti we are almost in control now. Yeah, it's no longer spreading, which means my measures ya sevenza tamvera boma tagwirizana na boma na wa health. By the way, siwa health human doctors only, animal doctors, veterinary, our colleagues in the veterinary medical service, that one must be very, very active. They should look after the animal health, and we look after human health. Together we join hands, we can control these diseases very fast. For anthrax, the ones in front to prevent is the veterinary doctors, and we should work together. We are treating patients, they are also controlling the animal spread of the disease.
What message should the church be giving in this period of anthrax in the areas where there is anthrax reported?
Yes, I know.
To the congregants.
Yes,
in terms of taking
these days it's better to pray, but we have connectivity. You know, prayer to God is extremely important. There's no day you can spend without praying to God. But you have to pray as an individual. The measure is to pray as an individual so that you don't mix and spread the disease. In case you are the one who's heading cattle and you can't go to a church congregation when you suspect that you have anthrax, then you are causing serious danger to the whole congregation. But prayers should be done through individuals or through telecommunication like we are doing now. But prayer is extremely important. By the way, prayer in the morning, you remember, that Towera Nyirongo,
the song.
Amarumba Kulilesa. It's morning, noon, night, evening, every time you must pray to God. But a prayer as an individual in the area of anthrax. Assembling, you suspend.
Okay.
Yeah.
Now, it seems your relatives are not calling.
They are not yet calling. Okay.
All right. So, Professor, now you talked of some of the substitutes for meat that people should take. You talked of beans.
Beans, yes. In
the high cost of living, muntu like Lumezi, anasunga chabe mbuzi, pamene apama payako kambuzi kudiako zina isanga kwanise zashitabuaje.
But wakala anthrax, asayeso pambuzi, asayeso pangombe. Chifukwa siti ziwa ijambuzi alikupa ina anthrax oloyai. So danger yakuti azambo gawana. azambo gawana ijanyama obulachita spread anthrax ayembekezeko makamaka kuja makamba kwa tukulundazi bees aikonda wantu so muchite chabe depended bees for a while matenda yakata mbuzi za pulumuka azadi abwino kutsogolo but kuli anthrax olowa health maveti na madoctors wa wantu akaba kuti zonse nyama zili kuja zitentewe zipewe notentewa wopa kuti anthrax ingapitilize uchita affect wantu na nyama zomwe ingachite spread. That's why achita demarcate iyi area ni anthrax musalole nyama choka umu ugulisa kwinango olopaya mabucha wakuti awantu azigula munga unongese wantu wambiri munga unongese so viveto vambiri upyolera msachita control so wankuli walibe zisungweni mpaka matenda ya anthrax ya bwere pansi ya kale controlled.
Professor, I'm looking at our viewer on Facebook asking Dr. Lambert, do pigs and goats also get affected by anthrax?
Yes, they do. Yes, they do. Any animal, because the spores do not select. Piggy, goat, cow, even wild animals, they will also get anthrax.
Is there medicine to cure them?
Yes, they can be treated, but the treatment in the animals, we have to, for human beings is easy because they cooperate. If it's drips, you put drips. For animals, contaminated animals with anthrax, the best is to kill it and burn it.
Okay.
Don't bury, people can start picking the superficial ones. No. Kill it and burn it publicly so that the people know how dangerous it is. Yeah.
For people, like I said in my opening, that they've perhaps heard that there's anthrax, but they are doubting, they keep on eating meat. Even here in Lusaka, we don't keep animals here. Meat products are ordered from outside perhaps Lusaka, and then they are eating nimurungu amena sunga bantu, and they like, what would be a word to them?
Please avoid eating meat until anthrax is controlled. Meat from anthrax infected areas should be stopped. In fact, there should be roadblocks to stop people bringing in meat into innocent people of Lusaka. They will be dying just like any other, you know. It's very, very dangerous. We should discourage that.
Is it okay to enter a butchery and ask, where did you order this meat
yes, from? Where did you get this meat from? Yes.
And when?
Yes. Because now health workers, meat inspectors, they must stop that.
Okay. Professor, I'm told we have a call. Hello, caller. Hello.
Hello, good morning, Mama Indra.
Welcome to Lumen TV.
Yes, sir. Good morning.
The voice.
We can't hear.
Hello. Hello, Mwaka Bwanja Lambert.
At Mwaka Bwanja Lambert.
Na uka Mwaka Bwanji.
Kaya tifuna tifusako pari nkuku zina zachoka kumuzi. Kaya ili vinyama vina visungi wanawantu kumuzi. Pari nyama nyazari kumuzi. Nazo nkuku zima pezekapo za kumuzi. Nkuku zikoti sisi pezeka na matenda mena.
Bati ngatima
Bakari Kamba.
Aha, Kamba.
Pitirizani Kambani, mutiuze na kwa memtumira. Hello?
Mama yetu wanipita kukamba.
Hello? Wakamsa moti Kamba. Tiuze na kwa memtumira Dr. Lambert wambora funso.
Ichitebwa.
Okay. Dr. Lambert bayanke munamvera funso.
Navera funso ati nkuku nanga nkuku zinkali nayo. Mujanaka mbira kuti ngati nkuku ziruchoka ku malo ya Anthrax. Malo ya jampepo vonse kuja muri tumatende tu Anthrax tumaspores. So chiri chonse chiri upumira mkati tumaspozi tulowa. Mhuku, mbuzi, mhumba, ng'ombe. So musadie nkuku yochoka kumanja monga kujata kamba kuti kulumezi kuti. Asagwire nkuku yotero kudya. Mga tunga kalemo mkati tuma Anthrax.
Komba nsomba?
Yo, nsomba ibugu vikala mazi vija. Vikala mazi.
Hipo sankala mazi.
Hipo kala mazi batama tuluko puma kaya.
Katenga okay.
Yes.
Okay. So, our dear viewers, mukatuma phone ku TV yanu, mukazibwezako volume ndepa meti zamve sana buno bwino, ai? Kuti mfunse buno bwino, matiuza na kwa mine mtumira ni kuti, where are you calling from? Then you reduce your volume on TV. Where possible, even tell us your name. Mazina yanu mutiuze. So, Dr. Lambert, pajana funsa kuti bantu bena wangoti no ine au eat meat. God is the one who keeps people, who takes care of people. Lopena wa dwala, suna dwale ni mulungu.
Yeah.
But perhaps they are forgetting the importance of a healthy human being.
Yes. You know, the most important thing is to know human being was created by God. But God to use the earthly material to build the structure, the anatomy, the body head up to toe. Wachipanga na Adamu. Utakale moyo Adamu Mungu anawuziliramo mpweya, breath of life. That is in one verse, Genesis 2 verse 7. So a Kristo mziwerenga kuna chokera moyo wa muntu. But the combination is a biological body. It has systems. And this system is a biological, it can be diseased. And if it's diseased, Mungu anati pasaso nzeru da tipeze mankhwala ngati tupira Adamu lakala diseased mankhwala yaliko ndifukwa chake ape exafu naone mujana alengera mulungu mitengo vote vinali na meaning. So mankhwala yaliko asazengereze kuti ai Mungu anakupasani moyo mulinao moyo, but your biological body mufunika treatment mukadwala tamangirani kuchipatala musana meziwe kuti Mungu ala against chipatala yai. Mungu adziwa kuti ni muntu nalenga amadwala akadwala azipeza mankhwala yambiri yachoka muzimena natitengera aso mulungu monga vobera mera hivi mitengo mizuma yani yalimo mankhwala yeo.
Okay. Professor, if I heard you correctly, you say the spores are also found in the air?
In the air, yes.
Now, these spores that are in the air, is there a way they can be treated as well or controlled?
No, spores in the air, it's very difficult to eliminate them. That's why we are running to the source of these spores.
Okay.
The anthrax is in animals, wild or domestic. So that's why health is to go and destroy every animal which has got anthrax. Then spores will disappear.
Okay.
But as long as they are alive and they are moving around, their skin is full of anthrax. Their meat, they are breathing out, their fluids, you know. Mtundo wa nyama ya mtengo ina anthrax. Kwose kulima anthrax. Spores in the air. That's where the danger is. You breathe the air in the area of anthrax. You are taking in spores, which are very resistant.
Including manure then?
Including manure, yes. Don't touch anything that comes from that animal. Even a human body, when it comes to the hospital, even the spores of fecal matter, urine, has to be done with precaution. That's why the health workers have protective clothing to avoid the contamination of their own. through patients. So but patients must come quickly so that we stop and kill the anthrax before it kills somebody.
Anthrax is really a danger.
Very dangerous, one of the worst infections world over. And the cruel people can catch anthrax and go and throw it in the community. It's like a biological bomb. You know, that's very, very dangerous. So the anthrax is not something we should take lightly, but I'm happy that the Ministry of Health, the livestock fisheries, they have worked together and they have controlled most of the anthrax in the areas we have. This is very good, very effective.
Professor, the people following on Facebook, I'm just seeing a message. Thank you, Professor Lambert. My query has been answered. This was on pigs and goats. Another query. Zambia issued that they will not allow infected animals to be processed for human consumption. I heard you say, should we completely stop eating meat? Are you in a position to recommend some meat retail outlets one can buy meat from?
It's very difficult to say, but I hope that big shops, they are ordering meat from safe areas. Meat which is dangerous is now that listed area. That's why they announce, you know, southern, western, Lumezi, you know, Nawalia, in Luangwa. These are areas which have been spotted. And if you see the measures, they have included roadblocks. They don't allow anybody to move out of there with meat. And also they move in and destroy all the infected animals to make sure that we are at 0 point. We start restocking the areas there with safe animals, because it's difficult to eliminate anthrax from infected animals. It's not the same as human beings, because human beings can run to the hospital, say, no, I'm feeling like this, dry cough. Before it spreads in the body, we have started the ciprofloxacin, the drips, the follow-ups, then you control, but you have treated an individual. There must be mass measures, like prophylactic antibiotics, health education. Don't eat meat, don't do this, don't touch the animal. Even the skin of a dead animal, which are the anthrax, is as dangerous as the meat itself. Yeah, that's what the health is telling us. Yeah.
Now, Professor, by nature, a human being is always in motion. Now, in these areas where anthrax has been reported, is there in the times of COVID, we used to put on face masks, even sanitizing, washing our hands with soap and the like. Are there any preventive measures that people, in terms of clothing, that people can embrace in this period of anthrax?
As I said, it's an outbreak. During that period of outbreak, even transporting people from those areas to other safe areas, you are spreading the anthrax. So the justice there is to block people from moving out of anthrax infected areas. It's for a short time, so that the health workers can move in. Public health, environmental health specialists, the pharmacists, the doctors, the nurses, you will move in to go and stop the spread of the anthrax. And while we are dealing with human health, the veterinary group, the vet doctors, should move in and stop anthrax among animals. So it's a multidisciplinary approach. Everybody is important. The police should the roadblocks. Don't allow movements of animals, even humans moving anyhow. No, because you are carrying the spores. You don't know how many have got a dry cough. They are going now to go out of the areas where there's anthrax free, you're spreading. And spreading anthrax is it's a bombshell. You are going to make it more expensive to control because it's covering more geographical areas and more people.
Hello. Bwino toka Bwanji mutumira kuti ndi mwanjani.
Kawata zikomo. Amaika manga.
Yes, funsa wanu amaika manga. Ndiye funso yamveka yo nkuku tisazigula ndiye funso?
Ati?
Mufunsa kuti nkuku tisazigula.
Sazigula nkuku?
Abazayanka wa Dr. Lambert. Nkuku zaloni hizo? Okay, tamveza.
Amaika manga na kondwela kumva maulano, tizagwirizana kuyachani very soon. Zikomo, bati mujanaka mbira poyamba kuti ngati nkuku ilichoka ku anthrax area musagule. Malinganga tichoka ku anthrax area. Lomba mwaona watandiza wa health waboma gura nchito anthrax ilubera pansi chifukwa ja wantu wa malo ma anthrax anagwirizana ni wa health anagwirizana na wa veti matenda ilubera pansi but paka liromba ngati mufunsa uti kodi nkuku nifuna gula inachoka kuti ngati ni muno mu Lusaka wambira usunga nkuku ndebu zili sefu ndabuno mu Lusaka mukalibe anthrax mungadye.
Doc, as we come to an end, your final remarks?
No, very exciting topic, but very educative topic because we can protect people's lives as much as we can through this information. And also for our students in Apex and our staff, this is the idea. We must give our students adequate knowledge so that when they graduate, they are ready to go and improve health care services wherever they will be. We want the theory and practice skills and also attitudes, because for health work it's a calling or calling from God. Disciple Luke was a doctor, you know that, I'm sure. So please, we should unite and work hard to prevent. Prevention is better and cheaper than the cure. Friends who are all over, especially the areas of anthrax, even when we have controlled the anthrax, every year preventive measures should be applied so that anthrax does not come for the second or third time. We have learned lessons. We should take care of our animals, vaccinate them correctly and timely. Also make sure our health workers are ready to treat patients with minimal symptoms. Just skin rash, be careful, start treating. A dry cough, be careful, start treating. Vomiting, the first vomit, be careful, start treating, because it can deteriorate a body health, biological body health, until the patient dies if you are late. Also family members, community, please don't say somebody is sick, you will take him tomorrow. Especially in the areas of anthrax, there is no tomorrow. You may lose a patient. So as soon as you see the symptoms, take the patient to the nearest health center. Osa zengereza. Kwa tabuti zengerezu analinda kwa ukwao. That is very bad. Machedwa. You can lose a life. Ziko.
Professor Lambert, thank you very much.
Ziko.
Dear viewers, you are watching a Smart Talk, and on today's program we were giving a public awareness on anthrax in Zambia. And you've heard it all from Professor Turkson Lambert, Deputy Vice Chancellor from Lusaka Apex Medical University, in charge of academics. Until next time, when we bring to you another guest and another topic, bye. My name is Sydney Mwamainda.
Thank you.